In emergency care settings, feet may be left uncovered for several practical reasons, even when there are no apparent lower extremity injuries. These considerations typically prioritize efficient patient care, assessment, and comfort. Uncovered feet make it easier to perform quick neurological tests, such as checking for reflexes, sensation, or movement. Emergency protocols often involve monitoring extremities to confirm there are no hidden complications, like circulatory compromise or unnoticed fractures. Patients are often covered with blankets or sheets for warmth and privacy, but leaving the feet uncovered helps prevent overheating, especially if the patient is otherwise stable and the ambient temperature in the ambulance or hospital is controlled. In emergencies, care typically focuses on stabilizing the head, neck, chest, and vital systems. Feet are less likely to be a priority unless specific injuries are present. In some cases, leaving feet uncovered prevents accidental constraints or unnecessary movement, particularly if the patient's feet are naturally resting in a relaxed position. We explored one such case with our earlier video on Tylonia McGinnister. Now we'll do the same with several other patients and offer some new insight.
This is Raven Robertson, a 17-year-old who was in a car wreck. Raven's left hand rests on her abdomen, while her right hand lies alongside her body. Her body is covered with a sheet, except for her left foot, which is exposed, and a green oxygen tank was placed in between her feet over the sheet. This positioning might serve practical purposes. The left hand's placement could be a natural resting position that was deemed comfortable and safe given her condition. Secondly, it allows easy access for medical staff to check for vital signs such as pulse or to administer intravenous fluids if necessary. Placing the hand on the abdomen can also help ensure that it doesn't interfere with any medical equipment or procedures being performed on other parts of the body. The right hand being alongside the body suggests a standard position for immobilization, ensuring it remains stable and does not interfere with any ongoing medical procedures. Raven's feet are lying flat against the stretcher and pointing upwards. Her left foot seems to be tilted outward, around 30 to 45 degrees from a neutral alignment. This angle could be due to the natural resting position of the foot or an attempt to avoid pressure on a potential injury. Medical staff may have left the foot uncovered to visually monitor circulation, check skin color, or assess swelling. This can be especially important if there are concerns about Raven's peripheral blood flow or injuries. Raven was 2 months pregnant at the time of the accident, but her fetus was unhurt and Raven only suffered minor injuries. Estimating other measurements like shoe size is inherently imprecise without a clear reference for scale. Sam Hunt, a 32-year-old, was rendered unconscious and unresponsive after a motor vehicle accident caused head injuries. Sam is strapped to the stretcher to prevent movement and further injury during transport. Almost all of his clothes were removed to check for additional injuries. Inside the hospital, a team of medical staff is working around Sam. He is surrounded by healthcare professionals who are likely assessing his injuries and providing necessary treatments. The team is working quickly and efficiently, indicating that Sam is in critical condition and requires immediate and comprehensive medical intervention. Sam was taken to a CT scan for diagnostic imaging. By this point, it appears that 2 sheets are covering Sam and are tucked in between his feet, leaving them mostly exposed. In cases where a patient is unconscious, medical staff prioritize temperature regulation and minimizing additional stress. Since Sam was unable to regulate his own movements or cover himself, the medical team likely preemptively added a second sheet for coverage and comfort. Sam was in critical care for an extended amount of time but made a full recovery. In the ambulance, Sam's feet appear to be in a relaxed, natural resting position. His toes are slightly pointed downward, suggesting a plantar flex angle. The estimated angle is 25 to 35 degrees, typical of a relaxed position when the feet are not restrained or supported by splints. During the CT scan, Sam's feet are slightly more neutral, but still show some degree of plantar flexion at approximately 15 to 25 degrees. Sam's feet appear long and proportionate to an average tall adult male. Considering the scale relative to his body, the CT scanner, and surrounding equipment, his shoe size could be estimated as 12 to 14.
In this clip, 14-year-old Ashley Cordero was involved in a motor vehicle accident and brought to the hospital for emergency care. Ashley is seen lying on a hospital bed with visible injuries on her face. She is wearing an oxygen mask, and there's evidence of medical intervention to support her breathing. In their initial examination, Ashley was experiencing sensory issues. A CT scan revealed dehydration as the cause. Sensory disturbances due to dehydration can manifest as numbness, tingling, or even temporary weakness, depending on the severity and the areas affected. En route to the CT scanner, we see a sheet that is draped around Ashley's left foot, leaving it partially exposed and extending beyond the stretcher's left railing. During transport, the primary focus is on stabilizing critical injuries and ensuring safety. The precise exposure of her foot might not have been a high priority concern. Ashley's left foot appears to be resting at a slight upward diagonal angle relative to the horizontal plane of the stretcher. Her foot likely rests at 10 to 20 degrees relative to the stretcher's horizontal plane. Using the railing as a rough reference, the visible portion of her foot spans approximately 8 to 9 inches in length. Ashley's shoe size is likely 7 to 8, depending on her exact foot length and how much of it is not visible due to the angle or blanket coverage. In this clip, 15-year-old Shakia Austin was brought to the hospital after suffering seizures. Healthcare providers are working on stabilizing the patient's lower extremities, likely preparing her for transport or further treatment. Shakia is receiving assisted ventilation via a manual resuscitator, and she was later intubated as she was taken to a CT scan room. Additional tests revealed Shakia's seizures stemmed from a toxic pregnancy, also known as eclampsia. This condition is characterized by high blood pressure, protein in the urine, and sometimes seizures. If the pregnancy is far enough along for the baby to survive outside the womb, induction of labor or a cesarean section is often performed urgently to prevent further complications. In Shakia's case, the induced delivery likely helped stabilize her condition and saved both her and her child. After several weeks of recovery, both Shakia and her newborn child returned to normal. Shakia later enrolled at a school for gifted students. Exposing Shakia's feet during seizure care could serve several purposes. During seizures, it's essential to prevent injury while also ensuring that medical providers have full access to the patient's body. Feet might be left uncovered if there was a risk of involuntary movements or for easier application of restraints to prevent harm. Seizures and critical medical interventions can cause fluctuations in body temperature. Exposing extremities can help in maintaining an appropriate temperature balance, especially if overheating or cooling is a concern. Estimating Shakia's shoe size from the available clips is possible by comparing the length of her foot to the visible width of the stretcher. Based on average foot sizes for women and her body proportions as observed, a plausible estimate would be U.S. women's size 6 to 8. However, this method relies heavily on assumptions and visual scaling, which are not precise.
Hope is a young woman who was involved in a serious car crash, resulting in a right leg injury, including a deep laceration. She was conscious and alert, which is a positive sign regarding her neurological status. One EMT conducts a neurological assessment of Hope's legs and feet, checking for reflexes, sensation, or movement. Another EMT is seen administering care, likely including intravenous fluids or medication to manage pain and prevent shock. Hope's feet are visible, and her right leg is immobilized to protect it from further injury, infection, or complications until she can arrive at a hospital. Later, Hope is shown with an oxygen mask, indicating she is receiving supplemental oxygen to ensure adequate breathing. Her leg injury required a skin graft and weeks of physical therapy, but she made a full recovery. The resting angle of Hope's feet appears to be close to a natural resting position. Assuming the feet are relatively relaxed and not actively flexed or extended, the resting angle might be around 90 degrees relative to her legs. This is a typical angle when a person is lying down with their legs extended. Estimating Hope's shoe size requires some assumptions about her height and foot proportions. Typically, the length of a person's foot is about 15% of their height. Based on approximations, Hope's shoe size will be around 8 to 9, but actual measurements may vary. Injury severity can influence emergency care elements, like this woman who was rear-ended in a car crash but was able to walk to the ambulance on her own. Although the woman does not have any severe injuries, she is being treated with caution. She lies down on the stretcher while a cervical collar is properly fastened around her neck. The paramedics are focusing on stabilizing her and closely monitoring her condition to ensure her safety during transport to the hospital. Additional monitoring equipment is attached, including blood pressure cuffs and cardiac leads. The woman has one hand resting on her abdomen while the other is loosely resting by her side. This positioning suggests a relatively relaxed or semi-conscious state with no immediate signs of distress. In many emergency situations, whether a patient's clothing and shoes are removed depends on several factors. If there are no visible or suspected injuries to the lower body, such as fractures, bleeding, or swelling, medical professionals may leave clothing and shoes on to prioritize stabilization and faster transport. In this case, the woman's lower extremities likely showed no signs of trauma that required examination, so her shoes and pants were left on. Her feet appear to be resting at an outward diagonal angle. Based on her position and the alignment of her legs, the angle of her feet relative to a straight vertical axis looks to be approximately 15 to 20 degrees outward. This angle is typical of someone lying on a stretcher with relaxed posture and no constraints on foot movement. Estimating shoe size is trickier with her UGG-style boots, which tend to have a slightly larger and bulkier appearance. This can make her feet appear larger than her actual size.
Thank you for watching. Be sure to check out our upcoming content on this channel.